is a gift of nature, and age is a work of art and science. We can't stop aging, but we can age in a healthy manner. Welcome to Wanja's Health Diary. Today, we talk about older persons and their health needs. On set, we have Dr. Muthoni Gichu, who's going to take us through a very interesting field. Welcome. Karibu sana.
Thank you.
Tell us what you do and why are older persons an interest in your daily life?
If you look back at history,
we
talk about social injustices. Maybe this is just one of them. We were looking at children living beyond the age of 5. That has happened and we're happy about it. We're looking at adolescents who are growing and our population is growing bigger every day. So where do these children that we were hoping would get to the age of 5 go to after the age of 5? They grow with life. And if you look, for example, at the census, we had about 200,000 people at the first census. We are approaching another census this year. So in the last census, we had close to 2 million people. That tells you we had a great percentage increase in older persons. When you look at healthcare needs, we have focused on the various cohorts or categories of people. And that is why there is need to take care of a growing population. It is not only a Kenyan phenomenon, it is a global phenomenon.
Interesting. So when we talk about older persons, there are 2 areas of science that are quite interesting and a speciality. So when you talk about geriatrics and gerontology, they're quite a mouthful, but what do they mean?
So when you look at gerontology, it's the whole scope of the study on aging. How is the process? What are the needs? How do people get to be old? It's a whole process. When you look at geriatrics, is a medical specialty that focuses on offering treatment and management of older persons. But again, this is probably something we have not looked at. Who are older persons?
Yes, who are they? At what age would you consider somebody to be an older person?
The UN definition looks at people who are 60 and above. But again, sometimes this can be stepped down depending on your geographical region. But for now, let us operate with 60. Again, it's the age of retirement, so let us operate at 60 and above.
What are some of their most immediate health needs? And then later we can look at their social needs.
This is an interesting one, and more so because we do not have data. Because if I asked you how many children are born in this country every day, it is possible to get that data. But how many people get old every day? We can only estimate. That is one. Secondly, our system has not been very geared towards older persons. But again, there is a need. Are we responding to the need? Do we need to respond to the need? And the answer is yes, we need to. Because they too are people, they too have a right to health. And when we talk about SDG, we're talking about leaving nobody behind. So if we leave these people behind, it means we will not achieve the SDGs.
Geriatrics is an interesting field, which is a medical specialty that looks at the treatment of persons who are above 60. How are we doing as Kenya? Do we have that expertise here?
Unfortunately, or fortunately, we don't have a geriatrician in this country. But we have a medical gerontologist and 2 social gerontologists. But looking at it, the government is doing a great job because, for example, the KMTC is actually beginning a course on a higher diploma course on geriatric nursing. So it means we are a step in the right direction. And for your information, in the whole of Africa, South Africa has a diploma for doctors and nothing on nurses. So as we only have South Africa and currently Kenya in the whole of Africa.
Take us through, a typical day in the aspect that we will get a medical gerontologist, right? What are some of the things that will be on his or her table?
First, you get this lady who's 80, is on, for example, 19 prescriptions that they're supposed to take at different times. That means they could be taking drugs at 5 different times during the day. When you look at their cognitive function, how easy do you think it is for them to remember all that? So sometimes you have to sit back, look at what it is that they are presenting with, see what things that you need to combine, and then also remember, the more the drugs, the more the side effects. Where does that leave you? What does that leave them? They need a life, as in, a quality of life. All they need to do at that point is sit and take in a drug after a drug after a drug. They are alone. how do they even remember the schedule?
So it's a field that, wants to come in and be that doctor who takes, also considers your age and helps you manage your health conditions.
Precisely because, like we say, children are not small adults. So older persons are also not normal adults. Because again, remember, with aging, a lot of things happen. And when these things happen, you also need to take consideration of these things when you're doing, for example, the prescription. What do you need to give? How do you give it?